Pregnancy is often a time of joy and anticipation, but for some, that joy can be suddenly replaced with sorrow. Miscarriage, the unexpected loss of a pregnancy, is more common than many realize, yet still surrounded by silence and emotional pain. Understanding it is the first step toward healing. What is miscarriage? A miscarriage is one of the toughest experiences a woman can go through. It's the natural loss of a pregnancy before the 20th week, often happening in the first 12 weeks, sometimes before a woman even knows she's pregnant. It's more common than many realize, with about 1 in 4 pregnancies ending in miscarriage. The risk increases with age, going from 10% in your 20s to over 40% by age 40. There are different types of miscarriage. A threatened miscarriage comes with light bleeding but may still result in a healthy pregnancy. In an inevitable miscarriage, heavier bleeding and an open cervix mean the pregnancy can't continue. An incomplete miscarriage may require medical help to remove remaining tissue, while a complete miscarriage means everything has passed naturally. A miscarriage is often discovered on ultrasound, when the baby has stopped growing without any symptoms. Recurrent miscarriages, 3 or more in a row, require further testing. Miscarriages are usually early, before 12 weeks, often due to genetic issues in the baby. Late miscarriages, between 12 to 20 weeks, may be linked to maternal health problems or infections. Most importantly, it's not your fault. Miscarriages happen for reasons beyond your control, and while it's an emotional journey, you're not alone. Healing is possible. Causes of miscarriage. When a miscarriage happens, one of the first questions that crosses a mother's mind is, why? The truth is, in most cases, it's not your fault. Miscarriages are usually caused by a combination of natural factors, many of which are completely out of your control. One of the most common causes is genetic abnormalities in the fetus. This means something went wrong with the baby's chromosomes, those tiny structures that carry all the instructions for life. These errors happen randomly and prevent the baby from developing properly. In fact, more than half of early miscarriages are linked to genetic issues. Another factor can be hormonal imbalances, especially when the body isn't making enough progesterone, the hormone that helps support the pregnancy in the early weeks. Without enough of it, the uterus may not be able to sustain the growing embryo. Chronic health conditions in the mother, like diabetes, thyroid disorders, or certain autoimmune diseases, can also affect pregnancy. The good news? Many of these can be managed with the right care and treatment before or during pregnancy. Infections, especially severe ones or those that reach the uterus, can increase the risk of miscarriage. This includes certain viral, bacterial, or parasitic infections. Then there are lifestyle factors. Things like smoking, drinking alcohol, and using drugs during pregnancy can all raise the risk of miscarriage. But if you made mistakes before you even knew you were pregnant, please be gentle with yourself. Many women do, and it doesn't mean you're to blame. Problems with the uterus or cervix, like a misshapen uterus or a weak cervix that opens too early, can also contribute, especially in second trimester losses. These are structural issues that often require a doctor's evaluation and care in future pregnancies. Lastly, advanced maternal age plays a role too. As women get older, especially after 35, the risk of miscarriage naturally rises. That's because the quality and number of eggs decrease with age, increasing the chance of chromosomal problems. Remember, most women who experience a miscarriage go on to have healthy pregnancies later. And if you're ever unsure or worried, don't hesitate to speak with your doctor. They're there to help, not to judge. Signs and symptoms of miscarriage. Every woman's body is different, and so is the way a miscarriage may begin. Sometimes the signs are clear, and other times they can be confusing or easy to miss. That's why it's important to listen to your body and reach out to your doctor if something doesn't feel right. One of the most common signs is vaginal bleeding or spotting. It may be light or heavy, and the color can range from pink to bright red or even brown. While light spotting can sometimes be harmless in early pregnancy, any unexpected bleeding is worth checking out. You might also feel cramping or abdominal pain, similar to period pains. This can be mild or quite strong and is usually felt low in the belly or in the pelvic area. Some women also experience back pain, especially in the lower back. Another possible sign is passing tissue or fluid from the vagina. This may look like clots or grayish material, and it can be upsetting to see, but it's often part of what happens when the body is naturally trying to end the pregnancy. Sometimes a woman might notice a sudden drop in pregnancy symptoms, like feeling less breast tenderness, nausea, or fatigue. If those symptoms fade quickly in the early weeks, it might be a sign that hormone levels are changing due to miscarriage. It's important to remember that not all bleeding or cramping means you're having a miscarriage. But if you experience any of these symptoms, especially more than one at a time, it's best to call your doctor. Getting the right support early can make a big difference, not only for your health, but for your peace of mind. How is a miscarriage diagnosed? If you're experiencing symptoms that could point to a miscarriage, it's natural to feel scared or anxious. The good news is that doctors have gentle, effective ways to find out what's going on and guide you through it with care. To begin, your doctor may perform a pelvic exam to check if the cervix is opening or if there are any signs of bleeding or tissue passing. It's a simple exam, and while it might feel a little uncomfortable, it helps give important clues about what your body is doing. One of the most important tools is an ultrasound scan. This allows doctors to see inside the womb and check how the baby is developing. They'll look for the baby's heartbeat and measure growth to see if everything looks as it should. Sometimes, especially in very early pregnancy, they may ask you to come back in a few days for another scan, just to be sure. Along with that, blood tests are often done to measure hormone levels, especially a hormone called HT, human chorionic gonadotropin, which rises during pregnancy. If the levels are dropping or not increasing as expected, it may suggest that the pregnancy isn't progressing normally. These tests can be emotional, but remember, they're done to give you clear answers and to help you get the care and support you need, no matter what the outcome is. Treatment after a miscarriage. Going through a miscarriage is deeply emotional, and when it happens, one of the first steps is understanding the treatment options available. The approach your doctor takes depends on the type and stage of the miscarriage, as well as your personal comfort and health. In many cases, doctors may suggest expectant management, which simply means giving your body time to pass the pregnancy tissue naturally. This process can take days or even weeks, and while it may be physically and emotionally challenging, some women find comfort in allowing nature to take its course. Another option is medication. Your doctor may prescribe pills that help speed up the process of expelling the pregnancy tissue from your uterus. This option is usually taken at home, and while it may come with cramping and bleeding, it allows for more control over timing. In some situations, especially if there's heavy bleeding where tissue remains in the uterus, a surgical procedure called dilation and curettage, D&C, might be necessary. It's a short procedure done under anesthesia where the doctor gently removes the tissue from the uterus. This option provides a faster physical recovery and is often recommended if there's a risk of infection or complications. But healing after miscarriage isn't just physical, it's deeply emotional. That's why emotional support and counseling are such an important part of recovery. Whether it's talking with a therapist, joining a support group, or simply leaning on loved ones, know that you don't have to go through this alone. Whatever path you take, give yourself grace and time. Your body and heart are healing and both deserve kindness and care. I know this journey can feel incredibly tough, but remember, you are not alone. Whether you've experienced a miscarriage or know someone who has, it's important to honor the feelings and the healing that comes after. Thank you for watching, and like and subscribe for more informational content.